Let me elaborate a question here for you to enter this topic. We just mentioned that treatment planning is the most important part of what we do. We need to understand how to treatment plan. You also agree with me that treatment planning is basically a decision-making process, right?
For sure.
If it's a decision-making process, means somebody needs to decide. Decision.
Yep.
The dentist is making that decision by himself, usually because the patient is not there. As you're treatment planning, you're preparing a presentation to present to the patient maybe the next day. So you're treatment planning alone or maybe with some colleagues. You're deciding on things. And that is exactly why I love your topic. You said conflict of interest. First, I would like you to explain what means exactly conflict of interest, like very didactical as the meaning of this sentence, and how important it is to understand when you're making decisions for the patient, how can you avoid conflict of interest?
I mean, I can go ahead and read the exact definition of Wikipedia for everybody to hear it, but bottom line, conflict of interest is your decision or your attitude towards a product, a concept, a line of thought, maybe, I don't want to use the word tarnished, but may be influenced by
contaminated.
A greater good that you will be getting out of it. So, for instance, this is why I said, let's understand the misunderstood conflict of interest. Of course, if I'm giving a lecture for Ivoclar Vivadent, where I'm saying, okay, this lecture is partially sponsored by Ivoclar Vivadent, it's very different if I say it as a speaker or if I don't say it and I get compensated. So one thing is for sure that every speaker that is compensated, and I think it's perfectly legit to be compensated for our lectures by companies, which could have different readings in some members of the audience, but at the end of the day, there's nothing that's going to be 100% well received.
But then you should the disclaimer, of course, it's key. As teachers, we need to start saying, I have this benefits here, I'm sponsored by this, because this is a way that the audience can be protected and filter what you're saying, and then you also feel more free to say whatever and support whatever company, because you already said what are your benefits from that. Now, the dentist should do the same with the patient, maybe. You know, when you're explaining something to the patient, somehow you should say like, look, I enjoy much more doing implants than doing endo, so that may have an influence on what I'm going to tell you. I believe you should extract that too. But I want you to know that I'm better with implants than with endo. And that may influence what I'm saying. Now, you patient, you take that home and you think about what is better for you. Yeah?
So, yeah. So hear me out. At the beginning of the show, you said something that you and I have in common, which one of the things that we have in common, because we have a ton of things in common, but one of them is we are okay taking the heat. We are okay being challenged, because being challenged only makes us grow, right? Well, here's the problem. I think that many speakers don't like to be challenged. And that then becomes that many speakers and many educators and many people that in fact get information from social media, which is like almost a crazy place to get information from, because it's confirmation biased. You know, there are so many self-proclaimed gurus doing so many things. But the bottom line here is, I wouldn't encourage audiences to challenge everything they hear. Regardless of how much you've disclaimed, I mean, we know that you, Christian Coachman, among other things, are the developer of DSD. You have every right, you know, to share the enthusiasm and magic of what DSD is doing. Do you have a conflict of interest when every time you talk about DSD? For sure you do. Nothing wrong with it, okay? The problem is when you don't disclaim it, or the problem is when, I mean, again, as speakers, we can only share with audiences this piece of information, because we have time slots to cover. If you have a 1-hour lecture and you're lecturing on a specific topic, you cannot say everything you know about that topic. So you distill it in what you think are the key points. Now, if you look at those key points, you may find conflicts of interest all over the place. No. We have close friends that are, I'm going to mention a name of somebody that has been in the show, who's a phenomenal scientist, Marcelo Calamita. Marcelo Calamita knows the literature inside out. And if you read the literature, you will know that every single article written, if you read between the lines, you're going to see conflicts of interest. Because every single researcher will try to prove the concept based on his null hypotheses. And
yeah,
so
I just watched that TED Talk that you suggested. Actually, amazing. We should share it everybody later. But it's something interesting because when you start a research, when you start an article, how do you start an article? You have an idea, right? Said, I have an idea to do this way. And why? Because if you do this way, probably this is going to happen for our benefit. So now I have to prove that we have this benefit, right? So now I'm going to do a research to prove this benefit. And that's conflict of interest because you're already entering a research.
And you know what the problem is with people that read the literature?
Push for a result. Because otherwise you don't have a lecture.
So, and these are the articles that have some science into it, because a lot of stuff that we read, there's no science, there's just show and tell. But if you go into an article that has science, you know which is the part of the article that's more important? You know, you have materials and methods, then you have how the procedure was done, then you'll go for results, then you'll go for discussion, statistical analyses, conclusions. You know which is the most important piece of it all?
Tell me.
And anybody in science should agree. The most important part is discussion. And why is it discussion? Because if a well-written article has to contrast their findings to the findings of other people that have researched something similar. And so that's the only way that you can create some sort of conclusion that may be more adhere to the actual truth. Now, you start digging into materials and methods, and you start digging into what was done, and you're going to see flaws in pretty much every article out there. And so again, if we look into that, right there, you'll see there was some conflict of interest. And so which means, once again, that us as audiences need to be wary. We need to be doubtful. We need to challenge everything that we hear. Now, granted, in the lecture circuit, you will find speakers that transpire that they're doing it out of they're truly doing it because they care to share what they feel works in their hands, right? And so, again, you look at the lecture circuit and you're going to see different names out there that do transpire that energy that, this is worth looking into. My problem as an educator is when I see people that it is so easy to mislead audiences. It's the easiest thing to do. And so when we do that, we don't realize how damaging our message can be. And so this is where I think every speaker has to really think twice before, saying something.
The responsibility,
You are so responsible. And so, last week I gave this lecture on, again, terminal dentition, and with a question, where do we draw the line? And, in dentistry, there are so many different lines. It depends on what you want to talk about. You draw a bunch of lines when you do DSD. Those are different lines. Those are digital lines.
But, when you're lecturing, there's many moments in your lecture that, as you're lecturing and speaking, you are organizing your phrases and your sentences. And you know that if you use this word, you're probably going to be closer to the truth. But if you use that word, you're going to look good. You're going to look better on stage. And many times you want so much to say word B because you're going to look better there than saying word A that is probably more honest and down to the real truth. So it's an exercise. Every sentence that you say can be interpreted in a different way, and you can manipulate the words to look good. Just to make your message look better, you know, even if it's not actually what you believe in it, or it's not exactly how it happens, you know. Sometimes you're using this strategy because you have a bigger message in total, that you want people to get to that story and really understand that at the end the whole message is great. But it's a conflict of interest as a teacher is an amazing topic. And for me, it's just people looking in the audience. You need to just filter over and over and over again, every single day, every single moment. Because even if we have the best intentions, our brain can manipulate ourselves to say things that are not exactly what is going on, you know.
I totally agree with you. In fact, as I was hearing you, I'm thinking the adrenaline of being on stage, you've got the spotlight and you've got people watching you. And when you do this long enough, you start reading the audience.
Yep.
And you see their faces and you see how connected you are with them, either by them nodding or by them, you know, looking at you in a critical way. And that right there is a conversation that's going in the back of your brain while you're saying another thing, right? And you
want to be approved. You want to be approved.
But there's a magical moment in which you choose to do the right thing, because that's the way it should be. But at the end of the day, you know, we're so filled with conflicts of interest. Put it this way: which cases do we choose to show in a lecture?
Well, I just don't think it's that easy. You know, we can choose and say, I'm here for the truth and for the best. But if you analyze, you know, 10 years of lecturing, you look back and you say, many times I mixed things, not because I had a bad intention, but because I'm human, because I have an ego, because
I'll tell you when the good lecture happens. This is my belief system, okay? I may be wrong, but this is what happens to me. The better lecture is that lecture when I'm able to locate one person in the audience and I'm talking to that person, and I'm totally transparent to that person. And that person's name is me. I cannot bullshit to myself.
That's a good strategy.
When I bullshit to myself, somebody in the audience will pick up that I'm bullshitting.
I'm going to compliment what you just said. What you just said is amazing. You know, everybody that lectures should listen to this. You need to picture yourself in the audience. Look at that person, pretend it's yourself, and be ashamed of yourself if you're bullshitting to yourself, because yourself. And you know how you can do that? It happened to me a couple of times when your wife, probably the person that knows you the most, my wife knows exactly every single bullshit about me. You know, everything I say, she knows bullshit, bullshit, bullshit again. Now, when she's there listening, I can tell you, I'm 10 times more careful about how I'm going to express myself. Because at the end, she's not going to say anything. She's going to look at me, and I know that she's looking at me and saying, "Ah."
Of course. So,
what do you think about that?
For sure. No, for sure. So let me just share with you something that's really, really cool for the audience to hear. So as speakers, we don't know how received the lecture is. Of course, you leave the podium and people will come and give you all sorts of accolades. Oh, that was amazing. What a lecture. You changed my life. That's all a bunch of bullshit. Okay? It really. But then you feel so pumped because you hear all these.
It's not a bunch of bullshit, but it's hard to filter what is and what is not.
Exactly,
you know?
Exactly. So, but hear me out. Ever since I started with Spear Education, can you only imagine lecturing side by side with Frank Spear or Greg Kinzer? Every single lecture, the audience is filling an evaluation sheet. And so they're essentially comparing my lecture to Frank Spear's, who's the ultimate guru. So I cannot tell you how humbling it's been to read feedback. And so at the end of the day,
not easy.
The only true weapon you have on your arsenal when you go out and lecture is to be true to yourself. Because if you're trying to show how good you are based on, I got to show them that's insecure, that's fear, that comes across. And as you know, if you are fearful, when you come close to a dog, he'll bite you. If you're fearful, if you hop in a horse, he'll knock you down.
But then you have another problem. I saw that happening many times. Some people become so good bullshitting that they start to believe for real on that. And I see that happening. And if we're not careful, that happens with us as well. We believe, and the message is great. The lecture is amazing. You strongly believe, and everybody's like, wow. You know, that's why the wife test is the best. Because when the wife is there, everybody's like, wow. And the wife comes back to you and say, this is exactly the truth. You know, you missed a point here and there. You got so excited about what you were saying about yourself or about your position. You got excited with the excitement that you went away a little bit from being honest with yourself, you know.
The line is very thin, again.
Yeah.
It's so simple. And once again, we're caught with the excitement of the lecture, the spotlight, the adrenaline, the crowd. Sometimes we have to have a closing message and the clock is ticking. These are things that people don't quite see unless they are part of the lecture circuit, you know. But yeah. You grow. And at the end of the day, again, you know, I really believe in this concept of less is more. And you got to be very, very clear to yourself as to what do you want the message to be? What do you want the message to be? You know,
the final conclusion here is call the wife of the speaker and ask her, what do you think about what your husband just said?
That works.
That's a great thing to do, actually. But I want to move from conflict of interest in the lecturing circuit. I think this is a great discussion we just had. Really, really very important to explore more and more of these topics, you know, to put pressure on us as speakers. You know, we need to control ourselves more on the content that we share. We need to understand the power we have and how our responsibility is huge when you're speaking from above and people are actually listening to you. It doesn't matter if people in the audience are more smart than you. You are on a position that you have the power of the microphone, and this can be dangerous. But I want to bring this discussion to finalize as our final topic: conflict of interest as a clinician selling dentistry. Right? We had an amazing discussion yesterday about this. We have people teaching dentists how to be persuasive, and I can tell that because since 7 years, DSD became mainly a course on how to teach people how to communicate with patients, right? We teach people how to differentiate themselves, how to wow the patient, how to understand communication techniques, storytelling techniques, body language, persuasion, digital communication. And as I tell all the people coming to my course, the more you know about this, the more dangerous it is. And you have to put ethics above absolutely everything. You know, you need to protect your words with ethics, because when you're good communicating, you can manipulate people, right? And we were discussing with friends. We said to sell dentistry, and some friends were not happy. We don't sell. We are dentists. We are health providers. We don't sell. We don't sell. In my humble opinion, we sell every day, not only in dentistry. That's life. You know, when you're convincing somebody about something, you're selling. When you're trying to make your kid do something, you're selling your idea. When you're negotiating with a partner, when you're trying to get money from the bank, when you're presenting a treatment plan, it's all about the intention. You know, if your intentions are good, but if you believe that you have in your hands the best for the other person, you know, you're going to use your words to try to persuade people. And in the end, you're going to exchange your service for money. And for me, in the dictionary, the translation is selling, right? So what are your thoughts about all this?
You know, I told you offline, I just finished an article called The Biggest Dental Lie, and it should be published soon in our Spirit Digest. And I start with a very, very, very thought-provoking line. You know, when you go back to Nazi propaganda, the Nazi propaganda responsible, who I just forgot a name, used to say, you use a lie enough times, it becomes a truth.
Yeah.
So this is marketing 101. You could persuade and you could bullshit people. That's one thing that, of course, we'd like to stay away from because it really is, you know, it's harmful. But having said this, and going back to if we persuade people and if we sell dentistry, I wrote a piece 2 years ago, and I'd be happy to share the link with the audience, called Utilizing the Buyer's Journey in Treatment Planning Communication. So the buyer's journey is a concept that has nothing to do with dentistry. It has to do with marketing. You know, as buyers, we typically go through a 3-step journey. And we would be remiss if we don't think about patients as buyers, because sure enough, they are buyers. Now, you may choose not to see yourself as somebody that's selling, but the patient is certainly a buyer. And so that buyer journey has 3 stops, 3 very distinct stops. The first stop is the awareness stage. So the buyer has to be aware of what the problem is. And if this is a buyer, maybe the problem is I don't have enough shoes. I don't have enough suits. That's a problem. I need to go solve my problem. I need to go buy a new car. So, or as a patient, my awareness is I don't like my teeth or I cannot chew. So they are partially aware of their problem. Next comes the next stage, which is the consideration stage, which is based on this problem that I have, I can now consider solution number 1, solution number 2. I can choose shoes number 1 or shoes number 2 because I want to buy shoes. Now, thirdly, after going through assessment and then going through consideration stage, you then go through the last stop of the journey, which is the decision stage. And you make your decision based on price, on which solution you think is better for you. Now, you think about it, this happens as you are a buyer buying stuff. Same deal happens, not only through a patient's mind, but through the treating team. Think about this for a second. You work with your dad when you do clinical stuff, and your dad is a phenomenal orthodontist. And you, Christian, as a technician and as a restorative dentist, you have a lot of information from your end. But you don't have all the pieces of the puzzle. You need also to talk to your surgeon and to talk to your orthodontist. So that now, the problem the patient has, you've increased the level of awareness of what the problem is. So now, based on what the orthodontist said, based on what the surgeon said, based on what the technician said, and based on what the restorative dentist said, now you've increased the level of awareness. Now you see the problem that needs to be addressed by different solutions. Now you can go through crown lengthening, or you can go through orthodontic intrusion, or you can go through, repositioning of tissue, and you have different solutions. And then finally you go through the decision process in which you go, okay, based on these potential solutions, we feel this is the best for the patient. Now, patient comes to you, and you go through the journey.
You feel it's the best for the patient. No, let me throw you a real scenario here. So you have a patient that comes to you thinking that he needs 6 veneers, right? Yeah. You analyze the case, and yes, you can do 6 veneers for the patient. But you realize that if you do orthodontics and you align the teeth, you believe it's a better treatment. Yeah. But at the same time, it's better business for you because now you will have, you will increase the value of the treatment. You're going to sell 6 months of ortho plus 6 veneers now. So when you are explaining the benefits of ortho, the conflict of interest is here. Patient is asking, doctor, are you trying to convince me to do orthodontics because it's the best for me or because it's going to bring more money for you? And of course, you're going to say, of course, it's because it's the best for you. It is bringing more money for me as well. So I cannot deny that it's better for me that you do ortho, right?
Yeah, it's a very simple answer. Go back to you lecturing to you when you are speaking, or your wife. You cannot bullshit you or your wife. The same deal. Listen, when you're communicating therapy to patients, Frank Spear calls this the tour of the mouth. When you give the tour of the mouth and you talk about solutions, and again, that's why I like calling this the buyer's journey. You put on the table what are the solutions. Now, you got to be very careful with the amount of solutions you offer. There's a great book called The Paradox of Choice by Barry Schwartz, who's a behavioral psychologist. You should not throw in there too many options, too many solutions, because you lose people. So based on that, you're essentially offering to the patient what you feel is in their best interest. Now, the big challenge here is that some patients don't know.
But exactly. That's what I say. People don't know exactly what is the best for them, you know.
I want you to think about this quote and never forget it. People don't know what they don't know.
As well, for sure.
That's crystal clear. And they come see you as dentists, see us as dentists, and we should not be giving a full day lecture to them. What we need to do, and you know this, that I told you before, the first thing we need to do is this. I'm going to move my screen. I want to show you my wall. It says, the world is giving you answers each day. Learn to listen. The first thing we need to do as clinicians is to learn to listen. Because part of the problem is dentists are not good listeners. We're not.
As well, this is another problem. This is another problem. But now when you're trying to convince the patient that the patient needs to do ortho before veneers, and you know it's the best for the patient, you know. And as I say many times, we need to save the patient from themselves, because they're about to make a bad decision for themselves because they think they know what is the best for them, right? So now you have the notion that is better for them to do ortho before veneers. Would you use your communication skills and your persuasion skills to convince the patient, even though the patient says, I just want to do veneers, doctor? Would you say, okay, we do whatever you want? Or you're going to use your persuasion and your charisma and your communication skills to convince the patient to do ortho before veneers?
I think this boils down to the following. If you let the patient know what are the consequences of choosing one option versus the other, the consequence of inaction or the consequence of doing veneers without ortho, patients don't want to listen that much either. But if you are clear enough, I mean, dentists have to be good
communicator. Yeah. The best persuasion is when you make the person decide for herself.
That's what I tell them.
But you're guiding. Great communicators, they make people believe they decided. Exactly. Oh, I made a decision. I decided I want to do veneers. But when in fact, the dentist was skilled enough to drive the conversation in the way, explaining the pros and cons and explaining the price that you have to pay if you say no.
Exactly.
The price you have to pay to say no, until the moment that the person will say, I got it, I want to do that, right? But that is exactly what we learn in persuasion books. So going back to the big discussion we had yesterday, and people say, no, I'm pure, I don't sell, I don't persuade. We persuade every moment, every day of our lives. It's just a matter of saying, if your persuasion is with good intentions and you're putting the other person at the center and you're thinking always on the other person, and it doesn't matter the impact of that on your life, you will always persuade people or try to persuade people to do what is the best for them.
And I think that transpires. You know, some patients will know exactly what they want, and they will not want to hear any plan B. And I guess for those patients, you may choose to treat or you may choose not to treat. At the end of the day, it's about how comfortable you are with what you're doing or with what you did. How comfortable you sleep at night. As it is, there are too many things that may wake us up in the middle of the night. And so the end of the day is, so long as you're okay giving the patient enough information for them to realize what is the consequence of them choosing one route of treatment versus the other, then it's their call, and I'm pretty good with that. The problem is when I see clinicians trying to persuade because of, again, a conflict of interest that sometimes goes beyond the money issue. It's just about, I want to do X amount of cases of this technique, so then I become the self-proclaimed guru of doing that technique. That's where I have a problem, And so that's why our seminar is called The Art of Treatment Planning and Case Presentation because there's an art to it.
Oh, yes.
There's an artistic element of how, I mean, and we've talked about this all day, I mean, for days and days. That's what you teach also in your DSD residence, the art of communicating to patients.
Yeah.
But
the
again,
art of presenting an idea.
if we're not good listeners, it's next to impossible to
one. That's definitely step number one.
Yeah.
To be able to listen, because then you adapt your strategy, you adapt your presentation. That's the key. It's not a standard presentation because each human being is different. So
exactly.
The art of listening, the art of treatment planning, and the art of presenting, they are all together.
And let me just say this one thing. Continuing, we always continue what the other one says. You hear? We always do this, you and I. Because each patient is different, because they think differently, because they're built differently, we cannot have a one-size-fits-all treatment plan for patients.
Of course.
You say, of course, but the problem with the obvious is that it's not that obvious.
No, it's not.
We have colleagues doing a one-size-fits-all procedures for all patients. And I'm going to call it out. We have
veneers is the number one. It's just whatever problem you have, I will fix with veneers.
Or terminal dentition. I decide you have a terminal dentition, and so the best thing for you is to take it, cut the bone out, and put implants, and that's a great solution for you. This is where I have a problem, because I'll tell you one thing. All on 4 is a phenomenal option. Incredible solution for the right patient, not for every patient.
I would say it's a great option when you don't have other options.
Exactly.
You say that?
I agree with that. And that's what we teach in our seminar, you know.
And I always like to emphasize a phrase that I heard the first, I don't know if it's his sentence, but from Yaki Gamborena, and coming from him, it really has a lot of power. He said, the more I know about implants, the more I love teeth. So yeah, I love that because it shows exactly the turning point we're going to now in terms of really understanding, thinking about the patient's quality of life long term, not about our business, because when that's the problem of bringing business to dentistry, because business people, they want a business model. And when you have a business model, you want to reduce the amount of options. And when you reduce the amount of options, you make more money because you have 1 or 2 procedures that you do very well. And when you have 1 or 2 procedures that you do very well and you have great profits, you try to fit everybody into those procedures, right? So on the treatment presentation, you train people to sell that procedure that you're good at because it's straightforward. Your whole team is trained to make money with that procedure.
So that, you know, treatment, the benefits of treatment outweighs the risk of no treatment. That's got to be the line. That's one. And secondly, just to wrap it up, you know, when you're offering dentistry, when you're offering all on 4s or all on whatever, you know, we all heard this quote that says that the means justify the ends. So do the ends justify the means? You know, and many times the means are the end. If you think about it, how we choose to act changes who we choose to become, changes who we are chosen to be perceived. And that's something that every clinician has to think about. You know, when we're doing things, why are we doing them? Because that will, at the end of the day, that will transpire. It's complex and kind of simple, you know.
It would be much easier if we didn't have to make money.
Of course.
That would simplify a lot the whole process, right? But unfortunately, we do have to make money.
And there's nothing wrong with making money.
No problem. But it is the challenge, you know, to draw that thin line, keep ethics, battle conflict of interest every single time you're speaking to people in life in general, but mainly when we are selling our dentistry and explaining our treatment plans. Understand exactly and do what we say that we call the ethical test about each phrase that you're going to use. bring that solution, right? And at the end of the day, when you're passionate about dentistry, I think that's the first step. When you're not when you're more passionate about your dental office than your dentistry or your business, you're more passionate about being a business owner than being a clinician, that's when we see the problems starting to happen. Nothing against being a business person, but in dentistry, building treatment plans, we should have people that are passionate about dentistry, because these people cannot sleep if they're doing a decision just because of money. People like you, I know if one day you push the patient towards an all-on-4 because you need the money to pay the bills that month, people like us probably going to have like a month not sleeping very well thinking about that, right? So it's a complicated topic, and I believe there's much more to be explored. Again, I don't know, Ricardo, but for me, it's always huge pleasure, to exchange information with you. Unfortunately, we don't meet as much anymore. We need to sit down and talk more. I like to really talk about philosophy in general with you, because at the end of the day, things need to make sense, right? Emotionally speaking, for us, that's what makes us happy, and when we talk about these tough topics, it looks like the idea starts to organize. You fine-tune your behavior, your attitude, you become a better person when you talk about these tough things, when you admit your weaknesses, when you admit that sometimes you're working on your behalf, and I think the only way to balance that is talking about it. It's exposing yourself. You said we are not afraid about exposing ourselves. Yeah, that's the truth.
I would wrap this up just sharing with you something that I an Instagram post that I did the other day. It's funny. I was in the treadmill in the gym, and I was getting ready to, mentally, as I was going to go lecture to give this lecture at the summit. And I had the closing lecture at Summit after 3 days of hearing, Chu and Tarnow and phenomenal speakers. And so as I was jogging, I thought about this quote, and then I wrote it, and then I did the post. And it says, "It only makes sense to do things right when you're doing the right things." In other words, you can be great about doing a technique, but only if that technique is the right thing. So think about it. It only makes sense to do things right if you're doing the right thing.
For the other.
Of course.
I would add for the other, yeah.
Of course. For somebody like you and me, that would be a given, that we're there to do good stuff for the others, right? Awesome. Well, great talking with you, my friend.
Ricardo, you cannot imagine how grateful I am. This project we just started, and people like you, we had already, you're the 8th. I had the pleasure to be talking to 8 amazing people, and there's of course much more to come. And I hope that in the near future we'll have a second edition of this chat, or maybe we're gonna develop even new ideas together. I know there's a lot to explore. I want to let you go back to your patients and your team, but from the bottom of my heart, thank you so much for opening time for us, my friend.
This is such a great project. That's everything you do. It's always a pleasure to share time with you, bro. Thank you so much, and I'll see you soon.
See you, my friend.
All right.
Ciao.
Take care.